Mental illness is a psychological pattern generally associated with the perception of disability in an individual. As such, the condition is highly stigmatized in Uganda. Because of this stigma, society hides and/or abandons the afflicted, denying them access to medical help. Those that attempt to treat the condition resort to traditional healers as opposed to seeking professional help, which may not even be efficient.
You find that there's not enough time for the clinician to carry out a psychiatric interview because there's a long line of patients who also need to see the doctor. So in that way, doctors end up not assessing patients for their mental health problems.
As a result of this, many cases have been misdiagnosed. The patients are given the wrong treatment, thereby intensifying the condition of the illness.
They present their emotional distress as physical symptoms so that the doctor will listen and pay attention. But the doctor will relate it to a physical problem, do some tests, and then say, the tests are normal, and the doctor will be puzzled.
The symptoms of mental illness include impaired judgment, which is a biological stress that weakens the body system. However, there are many challenges in treating the patients.
The numbers of health workers being recruited into the service is few. Much as we train a lot of psychiatric nurses and psychiatric clinical officers, but you find that the government cannot take them up,
Mental illness impacts on the brain and intensifies diseases like HIV, which is highly neuropathic. With severe lack of health services to those with mental disorders, progress towards a healthy environment is severely hindered. Craig Kadoda, NTV Tonight.